Good morning, everybody. This is September 12th, 2023, and it's the Board of Health meeting here at the Senior Center. This meeting is recorded. Approval of minutes. Approval of the minutes from June 26th of 2023. That's the last time we met.
Motion to accept.
Accept.
All in favor?
Aye.
Okay. Approval. New business. Appointment of Kyle Simpson as the agent of the Board of Health. Kyle? So we just have to approve
Yes,
your
but I'd just like,
appointment,
just to
but-
give a little intro.
That would be nice.
Kyle, yes, Kyle Simpson, we are very lucky to have Kyle Simpson as our new sanitarian. He's very experienced, he comes from Newton. He actually can cover almost all the aspects of public health, so he has a vast amount of experience in housing and food and all the other things that the health department inspects. So like I said, we're very fortunate to have him. Well, now we have two extremely experienced sanitarians, so we are very lucky, and just like to introduce him and have you appoint him as a health agent.
Okay, I make a motion. Kyle, can I ask a question? How long were you in Newton?
12 years.
12 years. Was that your first job in this area of
Yeah.
field?
Mhm. It was.
That was great. As compared to just knowing Norwood, because I know you live in Norwood, how vast is the difference of restaurants? Newton's a big city, isn't it?
It is, but there were 4 of us, so we had the city split up into 4
Look at
sections.
Angelo.
Yeah.
This is a long time coming. We've been fighting for
Oh
this
my
for a long time.
goodness.
so-
Okay.
So
All
we
right.
each had about 100 restaurants, so
Oh.
it's similar to the numbers.
Yes,
Yeah.
okay. Well, I welcome you with open
Thank you.
arms. Congratulations.
Yes,
welcome
aboard,
Thank you very much.
Very
Can I
nice
make
to
a
have you.
motion to accept for him in that position?
All in favor?
Aye.
You are appointed as an agent.
Okay.
Thank you.
Thanks, Kyle.
Thank you.
Good luck with everything.
Just make sure we have his phone number so we can harass him.
Oh, I do need Kyle's number. We all do. Angelo.
All right, let's not give it
Let's
out
not
right
give it
now.
on
No, not
Yeah,
on
but
television.
Angelo.
Okay, moving along. Dental clinic update.
Yeah, what's that?
Yes, the school dental program that we've had, it's a partnership with the health department and school department, the Norwood Smiles program. Is a long program that the town of Norwood has had with the schools, dating back to, I remember the program being when I was a small child.
I worked in the program.
You worked in the program. Dr. Stone did it for numerous years. And what happened is during COVID, it kind of put an end to it because you couldn't have obviously everything shut down. So dentists weren't going into the schools to screen the children for the dental program. So we finally, here it is 3 years later, finally have it up and running again. So I want to thank Jill Driscoll, who was key in helping spearheading this and getting this going again. But so our new contract is with Dr. Victor Nyakundi. He's at Affinity Dental on 45 Walpole Street. Yes. So what the program is, and it should be starting very shortly, is on Fridays, he will go into the schools, all the, so it's grades 1 through 6, he'll go into the schools and do a screening. So it's a quick screening of the children, you line them up, he does a quick look, and recommends sealants, cleanings, and that will be paid for by the health department if you go through Dr. Nyakundi's office, so Affinity Dental. It's all done through them. So any child wishing to go to this program can go to him and do some basic dental care, which is x-rays, cleaning, and like I said, some sealants. So, and the parents drive, so it's a little different than the program that we had years ago that it was at the town hall.
Right.
This is actually at the dentist's office, so the parents can set up the appointment and go, and that basic dental care will be covered by the town of Norwood, by the health department.
Do we we used to supply the instruments as the doctor walked in. When I did it, we autoclave the instruments, we set it up for him. Is that still the same process, or is he bringing everything and then taking it back?
So it's all disposable things. So we're not doing
Times
the
have
autoclave.
changed.
Times have changed. This is our first time doing that. Previously, the dentist would bring their own things, bring it back and autoclave it
Yeah,
because they
it's a
have
lot
the
of transport,
autoclave.
yeah.
It's a lot of transport, it's a lot of work. Now everything's disposable. So we'll have the little pick, the little mirror.
Will you
all
have
gets
a
used.
biohazard box in each school because it is?
Well, it's gonna be in his office, correct?
They're screened in the schools.
No, they're screened
So
in the
he
schools.
goes to the schools, maybe
Okay.
1 or 2 schools each Friday. He's gonna see how fast he
Okay.
can do it and how much time we can get in. The school nurses handle that. Again, schools have been a great, big help. Quick screening of the children. They get that little report that will
Yeah,
say
yeah.
that you need a cleaning or what the recommendations are. And then you make the appointment. But it's all just a quick look. No.
Well, a quick look still needs a bid in a proper
Yeah,
disposal
yeah.
of that, so will it be in a
Yes.
biohazard?
They'll have all that.
Thank
Yes.
you.
So is this something that they have to sign up through the schools, or is it open to
You can
everybody, or-
opt out, so there is a form all the parents will get. If you have a dentist and you're already, see a
Okay.
dentist and you go every 6 months and you have no
Yeah.
issues, then you don't have to go to this.
Okay,
And then, if you can even get an extra cleaning out of this if you want. But you go
Oh, yeah.
through and you can opt out and
so
not
in
do
other
it.
words, they don't, if you have insurance and you wanna go through this, you can still go through it?
You still
Okay.
can. You can get an extra cleaning if you want. Oh, and if you have insurance, they will bill the insurance.
Oh.
So if you have insurance,
Okay.
they're gonna bill the insurance.
They're gonna bill the insurance.
Yes.
And some,
Okay.
the insurance
Yes.
will only cover cleanings every 6 months, so you gotta
Yeah.
be careful for them, but they'll
Yeah.
figure that out.
Yes.
The office will certainly know
Right.
better.
Okay.
Well, that's wonderful to have this back in
This
town.
flyer is gonna go in all the kids at the
Yes,
school?
the kids,
gonna
they'll get the opt-out
Put it
form,
up
they'll
so you
get the
can see.
flyer.
It's double-sided, it's a nice flyer.
Very nice. Nice of him to do that, thank him.
Yeah, we were very lucky to have
Thank
him.
you.
That's great. Great, because that's a big commitment on his part.
Oh,
You know, he's
yes.
taking out on his own,
Yeah.
on his own time going in, taking over from his own business
Yeah.
and going into the schools. But he wanted to give back to the communities.
I
Okay.
love them, that's
Good.
great.
Excellent.
That's awesome.
Okay, so moving right along.
That was good news, Stace.
New permit fee for bottled water operation.
Yes, so this is a little different. So Castle Island is doing bottled water operation, and it is not licensed through us, it's actually licensed through the state.
state.
So a state inspector comes, it's all through the state. And so they are charged a $75 permit, but they split it, half goes to the state, half goes to us. But I'll need a motion from you to adopt a permit fee, which I would suggest $37.50. That's what most towns do, because we're splitting the $75 fee
Okay.
with the state. So
Who does inspection, Stace?
The state.
The state does.
The state.
inspection.
It's not us. It's water goes through the state. Bottled water's through the state.
Okay, so are
But
they,
Angelo did go. He went because he wanted to meet the person. They do a courtesy. They'll let us know that they're going to be in our community.
Okay.
And Angelo and Abby both went and just walked through and.
so is
Regular
it,
bottled water.
is it
It's just bottled water.
small bottles, or is it big bottles if is that, do you know what it is? Is
It was just regular
is it-
size.
It's a carbonated
Yeah.
beverage in a can.
Yeah.
It's non-alcoholic,
Oh, like Hawk.
like polar seltzer water.
Yeah. It's just
Yeah.
carbonated water.
Carbonated water, yeah.
Oh.
Flavored water.
And do they have contracts with stores already into them?
They do.
Oh.
They have a distributor there. They have a contract with that. They're going to be distributing the product.
So they're just gonna be a distributor, it doesn't necessarily mean that you and I could go there and purchase it?
They're going to be selling it, I believe, in the brewery as well.
Oh, they are?
Yeah, and they're going to process it in the brewery in
Oh.
Norwood House.
So it's carbonated water.
Yes.
Okay.
Yeah.
So we
Flavin?
could see this again. So you want to get we want to establish that permit fee.
Okay. Something you wanna make?
I'll make a motion to accept.
Yeah. I accept, yeah.
All in favor? We accept the,
Yes.
Yep.
the fee for
$37.50.
$37.50.
Thank you.
Bargain.
Okay, public health nurse report. Lots of questions.
I figured as much.
No, nothing bad.
Good morning, everyone.
Good morning.
So since I put out my report, things have changed within 24 hours.
Oh, okay.
Okay, so no longer are we offering any bivalent boosters, those are gone. Their state and everybody is done with the bivalent boosters. There's no there will be not, anywhere you go, they will not give you a booster right now
Okay.
of the bivalent. So the FDA had just approved the new booster, but it's still going through the process with the advisory committee on immunization practices and the CDC. So those are the last two people. I guess they're meeting today, at least one of them is meeting today, to see what else they need to do to advise how to, not to distribute, but like who gets it first type of situation,
Okay.
so on and so forth. So there's still information, there's no new information on when it's actually coming out, the new booster.
So is this the one they were thinking was gonna come out the end of September and
Yeah,
now
so.
it's still on
But
hold?
once it's approved by those two committees,
Okay.
then it might be like a fast takeoff from there.
So Diana, may I interrupt or you want to finish?
No, go ahead.
Okay.
So I did get a call on that, but two friends had an appointment at the CVS for next week.
Yeah.
For this. Should they continue or no?
If it's the new one, go ahead. But
If it's the new one.
But they can't get the old one.
Okay, what are they calling the new one?
Let's see. Monovalent single component that corresponds with the Omicron variant XBB.1.5. That's all that it says.
Yeah.
Okay, and is there a separation of ages, like, is it under 65, should over 65 gets one?
Right now, they're saying 5 years of age and older, regardless of previous vaccination, are eligible to receive a single dose of an updated mRNA COVID-19 vaccine, at least 2 months since the last dose of any COVID vaccine. So 5 years and older.
So there's no age different for the elderly or?
Nope.
No.
For right now, no. This is just, these are just came out.
Yeah, well, I heard it on the news, and then my two friends called and said, geez, I got an appointment to CVS, next week.
So this is just the bivalent that there's no booster?
Yeah, so
Do
the
we
bivalent's
still-
gone.
The bivalent's
So
gone.
first it was a monovalent, gone in April.
right.
Then they had the bivalent.
Bivalent.
Now the bivalent's gone. They just said put a full stop on it. No bivalent booster should
And
be
why
given
is
out
that, do
anymore.
you think, Diana?
Because I just think they want to get everybody to get the new one that's coming out. Because if you were to get the bivalent, you have to wait at least 2 months before you can get the new one. So if someone had recently just got the bivalent, it's good, don't get me wrong, that they got something, because it's still fighting off whatever strains are out there to a certain degree. It still works, but you have to wait now 2 months.
Is it one injection?
One injection.
And they are advising that you can get the flu shot with the bivalent? not
Absolutely.
With the new one?
Absolutely, just like
Okay.
before. You can get both at the same time.
Okay.
So maybe they'll call it the trivalent?
So what should the community look for? Because we don't meet for monthly. What should they look for? Just watch the news and get an okay from Moderna and Pfizer? Are they producing?
Yeah, it's Moderna and Pfizer that are producing it. They have already said that they're ready, set to go to get it out to the public. They just need those
pending
final
approval.
steps.
Well,
So,
that's the FDA, isn't it?
no, it's the CDC and the ACIP.
Okay.
Those are the final steps.
So the trials have been
gave,
completed for them?
yeah, so the FDA has given the okay, but it's the other two that are still reviewing it.
Yeah.
Once those two review it, then it should be set to go. But us as a department, we don't have any in hand. We haven't been able to order it yet either. So
Okay, so
that's
you're
going
ready
to
to
take
go
time.
on that? And will we get the same supply that we had last year? Would you request that amount? Because we did have a good supply.
Probably less because we didn't go through all of it.
Okay.
It seems like a lot of people didn't even want to get the bivalent, unfortunately. But healthcare providers say
Will we
you
have a
should
clinic?
get it.
Will you be going?
Absolutely,
Okay,
I will have clinics. Yes,
Thank you.
absolutely.
That was the question I walked in on when somebody called this morning. They said, no, we'll find out.
Yeah.
So we're not gonna do like we've done in the past, a major food clinic like we've done in the past? Are we not doing that anymore?
We don't have the capabilities, but at least I will be able to help with the seniors, get them all vaccinated, and then if schools, the staff for schools, school staff, department staff, buildings everywhere,
Yeah.
everywhere in the town I can get to for sure, and the seniors and people who are at home that are immobile.
So there was so much controversy about getting the immunizations, the shots. I was one of them that got very sick from them. Is this something that will
It's going to
hap-
be the same situation, unfortunately.
Oh.
If you might have the same
Febrile,
reaction as
fever,
before.
joint aches, teeth ached, everything ached.
Yeah, you might have the same situation as before, unfortunately, or you might not. Who knows? But
Yeah, I know.
It
I
could
just
be
want to
either
know
or.
if they kind of, could dug that out of there somehow.
no. Unfortunately, they said that you
Okay.
might have the same
They
reactions
did
as
say
before.
that. Well, that's fair. That's great, though. It's great that it's here and.
So they'll still be able to get it at their local pharmacies like they
Absolutely.
have in the past?
Yes.
So if they're setting up appointments, they just need to make sure that they have the newest
Absolutely.
one that's out there?
Yeah.
Okay,
As of today, nobody should be giving out any bivalent shots.
okay.
So.
Okay.
Thank you. I'm done with my questions.
Are you seeing an uptick?
Of COVID,
Yeah.
it's been throughout the whole summer.
Yeah.
Honestly, like hasn't gone away. So, and it's not going to, unfortunately.
Yeah.
And I've even seen the flu throughout the summer as well. So it's already started early.
Fauci said no masks.
No masks. Yeah,
So
we're
he thought-
done with it.
He
We're
doesn't
right
have
now.
anything to do with this administration, but he's retired. But I did read an article that said he's.
I think you'll
Does-
still see people that want to do what they want
Wanna
to
do, yeah.
If they want to
Absolutely.
wear a mask, they're welcome to wear a
Well,
mask.
we're not going to
Absolutely.
go back to 6 feet from the kids in schools and.
No.
I don't think
I
so.
don't think so, and I would think
No.
unless it becomes a pandemic. That was a pandemic.
Yeah, it
and
was.
We had nothing out there, so that was how we were trying to control it with masks to prevent the spread at the time.
Well, the CDC guidance still is if you were exposed, so I just,
Oh, right.
I don't want
Yeah.
to.
Go right ahead.
Diane, I'm
No,
sorry,
I read
Diana.
that too.
Actually, Diana, you can do it if you want, but if you see people wearing masks, I mean, they may have been exposed.
And they may,
be-
they may be 5 days post-op also.
Exactly, yes, exactly. So you will see masks out there.
Yeah.
So this is kind of a different note. I talked to our boss the other day, Mrs. Lane, and with all the refugees in Norwood, have you seen any activity? Are you involved in that at all, just so the public will know? We're
No.
not involved because of what reason? If they're federally funded? Is that so you can explain it?
Yeah, we have nothing right now.
We have nothing to do with that.
No, it's all state
It's all
regulated.
state, so
Yep.
they're immunized to go to school through the state.
Yes. All through the state, not through the town.
Okay.
Thank you.
Joan, do you have any questions? Okay.
She answered them all.
All right. Thank you.
Thank you, good luck.
Thank you.
Call us if you need anything.
Oh.
Okay. Environmental Health Inspectors Report.
My man.
Hey, good morning.
Morning.
Well,
Busy summer.
busy
Yes,
man.
just a little bit. Let's see here. The first order of business here is there were no updates for this meeting today. So there are no
Okay.
scheduled updates there.
Oh, can I see
And
that? Oh, yes.
Yeah. It just says no updates on here.
Thank you.
in the new food establishment report, the Courtyard by Marriott, the change of ownership is official. They've been open, obviously. And the Butter Your Biscuit is a food truck that services Moderna.
Okay.
They also have a restaurant in Beverly that they work out of as their commissary.
A lot of trucks up at Moderna. They really come out for
They
these food
do.
trucks, Angela?
They do.
Really?
Every Wednesday, I believe it is,
Uh-huh.
and Thursday now. So they hire a bunch of food trucks for their employees. Residence Inn, change of ownership, that's still pending.
Okay.
Mama's Bar and Grill and Little Tony's, they're still in the construction renovation phase. La Casita is at the tail end of their construction phase. They plan on opening the end of October.
What is that?
That is a burrito taco place across from the Bulge, thank you, yes.
Across from the Ball School?
Mhm.
Yep.
Where the library was?
Where,
Oh, you won't
um,
remember.
Where the nail salon was. The nail
Where the
salon was.
bananas.
Oh, that side. Oh, across
Yeah.
from
Yep.
Jacob's Plumbing.
Yes. Yes. Yep.
And Robin's Spicy Spice Mix is a residential kitchen, and she was permitted, I believe, last Friday.
Yes, after.
Yeah, after the report was printed out. So they are open for business.
You know the owners of Little Tony's?
Little Tony's is the former Vincent's,
But the
yes.
new owners,
Yes.
you know them? The
I
last
don't know
name?
them, actually, I'm sorry, I don't know the
His
last name.
name's Anthony, I don't remember his last name.
Okay. I heard they're very nice, but I just want to know their last name. Okay, Angela, that's great.
And on to the inspection reports.
What happened to As Good As It Gets?
They are changing ownership. They're due to open in October.
So they closed.
They are closed, and they are going to keep the same staff when the new owner takes over, was what I heard.
Actually, on the first page, I have 1A Pizza. Do they have somebody who's certified now?
Anti-choke, yes, they attended the anti-choke course that was offered at Town Hall
Okay.
by Beth, and they, I believe they have 2 or 3 employees certified now.
Okay,
Yeah.
excellent. I just wanted to make sure of that. As Good As Gets, we know about. We
Mhm.
know about them. Bertucci's. Is that something, do we need to put them on our list?
I would
think that's a good
I would
idea.
recommend the follow-up for the next meeting, put them on the update list.
Yeah,
Sure.
I just
Yeah.
was a little bit concerned
Okay.
about, I'm actually on page 4.
Yeah, it doesn't look like page 4.
Yes.
Yep.
I might print it out. Let's see, what else do I have? So we're gonna add Bertucci's to
Yes.
the list,
Mhm.
okay? Bright Path Kids, did they get somebody?
They did.
Okay.
And they corrected those violations several days after the inspection.
Okay.
And it was confirmed by myself with pictures and invoices that they submitted to me.
Okay. Chipotle,
Chipotle.
do you think they need to be added to our list?
Let's see.
What page are you on?
Page 8.
Page 8, yeah.
Page 6, see the market.
Oh, well, we'll go back, you can do that one when you go back. I'm just
Okay.
gonna hit mine.
Yep, good idea.
Certified food manager?
We can still do a follow-up for
Okay.
next meeting for Chipotle.
Yeah, I would like that. I
Alright.
just, I don't know, for some reason, they seem to be,
They have high staff turnover there,
okay.
especially with their management. So I think it would be a good idea to go back in there and do a follow-up.
Okay.
Yeah.
I think I'm a part owner with what I spend on DoorDash for my grandchildren.
Oh, is that?
What about the Dunkin' Donuts on Providence Highway?
Yeah, what is that all?
Yeah, what's going on there?
Yeah, they had to discard some food from their cooler.
Isn't that a new building, Angela, or am I thinking of the same
That's
place?
I don't think it's a new building.
No, it's not.
It's
Did
the
they-
one down in the back, right?
It's set back off of Route 1?
Yeah, but didn't they just do renovations?
A few years ago.
Oh,
Yes.
Are you concerned enough that we
Thank you.
need to?
I am not, because I went there,
Okay. Yeah, I saw you did do a follow-up.
there's a follow-up there, but the unit was still not working properly during the reinspection, so they were not able to use it.
Okay.
But on the 21st of August, they did repair it, and it was running at proper temperature.
Okay.
And they were allowed to use it. So I don't think a follow-up is necessary.
Okay, good, good. That's true. The other one that I had was,
Angela, while Kathy's looking, because I don't have any, I
Sure.
just want to ask you a question. When there is a food complaint, like if I went somewhere and I got sick, do you talk to the people back? Like if I made the complaint, do you call me back?
If they ask for a follow-up, I do contact them.
Okay, so
Yes.
a follow-up to the town, tell the people they have to ask for follow-up.
Yes. Yeah, whoever takes the complaint will ask them at the end of the conversation if they
Okay.
want to follow up after the investigation.
Okay, okay. Do you want to follow up with these?
And that's usually split 50-50 though. I mean, it depends who it is.
I just didn't know if we got back to them, but only on a
Yeah.
request.
Mhm, correct.
Okay,
Yeah.
thank you.
Many of them want to remain anonymous, so they don't want to follow up because they don't want us to have their name and number. They want to be able to make their complaint anonymous.
okay. Say right. The other two that I had was, Sire Market, did they attend the?
They did,
training
yes,
course?
they did attend the anti-choke course,
Okay.
yes.
And Quick Stop, 60 products
Which one is that?
expired. Quick Stop, it's almost on the last page, close to the last page. 60 packages of non-TS foods observed expired,
What page is that? It's on the top.
close to the last page.
Okay.
I don't have numbers.
26, 33.
I think we have a couple.
Yeah.
26.
What is it?
26. Sorry,
Quick stop.
Quick stop.
Okay, yep, got it, John.
Just was a little.
Yeah, there were non-TCS foods expired.
Yeah.
This was in July, so we'll probably go into October. We can do a follow-up with them and go back in there and check.
Oh, that's
Okay.
right.
Yeah.
We can do that.
I mean, that seems to be a lot of expired packages.
It is,
to me,
yeah.
You know, I mean, I understand that as they get close to expiration date, if they put them out, they can sell them for less money. If
Yeah, but
put
they have to
them-
have signage
They
and a
have to have
separate area
signage.
for it,
Right,
yes.
right.
Yeah. yeah.
But to have 60 packages,
Yeah,
means
that's-
somebody not double checking them.
Mhm.
So I just,
Sure.
that's my list. Anybody
Okay,
else
sure.
have anything?
What do you say about Sayer Market?
I just want to know that they went to the class.
Yep.
Because it did say they followed up with all of their,
Yeah, the reinspection was conducted a week after the routine,
Yeah.
and all those items that were in violation during the routine were corrected.
That's a
under the
big
inspection.
store.
It's a big store. It's a lot going on in there. So,
Yeah.
I mean, it's basically a supermarket, really. That's what it
Huh?
is. It's basically a
Basically a
supermarket.
supermarket,
Yeah.
yeah.
So,
but I like to know that they're updating on these
Mhm.
anti-choke
Yep.
things, you know, that's.
And Beth came out?
Beth does a class every summer at Town Hall, at Memorial Hall, usually in August.
So we had a fairly decent turnout.
We have, actually, yes.
Okay,
Yep.
good. Yep. Joan, do you have anyone here?
Yeah, I have a couple of them, Old Derby
Okay.
Village and Norwest Drive for the pools. Their skimmers were not secured.
Yeah, the skimmer covers, they should be secured when they're operating, so
Is
kids
that
are
where
not.
the kids' foot
Don't-
got caught and they drowned? that
Well,
type
they
of thing?
open it, they throw stuff in there, it's just, they should be secure when they're open.
Okay. Have we
they're
gone
operating.
back and checked to make sure they're covered?
No, they actually usually do it on site. They usually grab tools and screws and just put them in place
Okay.
while I'm there. Yeah,
So both of them did that? Okay. Yeah, my concern is we're starting to see no paper towels and toilet paper in the bathrooms again. I noticed on half a dozen of them. So it's, when you add things to your little classes and whatnot that you do,
Mhm.
maybe that might be a good,
Okay, sure.
And the other one I had was Cedar Market.
Excuse me.
Cedar Market?
Yeah,
What page, Joan, did you have?
back on page 6.
Yeah, I got it. Thank you.
Yeah, the routine was conducted on June 20th, then a follow-up, a reinspection was conducted July 6th.
Right,
And they did correct those violations from the routine inspection.
okay.
They're on the list for, I believe, it's either 3 or 4 times a year, so they should be due soon
Okay.
as well. They're definitely due before the end of the year again, so.
Okay.
yeah.
Are they keeping up with their pest control?
They are, I think it's weekly. They're doing a weekly service in there.
Okay.
It ebb and flows, I mean, it's, unfortunately, yeah.
It's that time of year?
Yeah.
Okay. All right, that's what I have. Every other, Kathy,
Yes.
Thank you, Angela.
All right,
Yeah.
thank you very
Oh,
much.
so just to update, Bertucci's and Chipotle.
Bertucci, Chipotle, and Quick Stop.
Quick stop.
Yep.
Right. Thank you.
Thank you.
Okay.
good job, Angela.
Thank you.
Yeah, man.
Yes.
Mr. Summer.
Thank you.
When do we get to whip Kyle?
I'm sorry?
When do we get to whip Kyle?
Either next meeting or the meeting after, we're not sure.
So what
We
they'll do
won't
is.
crucify him yet, please. We just tired him.
We want to ease him into the.
Yeah, so like we did when we had 2 public health nurses, they took turns. So
Okay.
they'll kind of do.
Yeah.
Okay, that works.
It does work. Okay, so, moving right along, MHAT report.
Hello.
Good morning.
So since I started in March, we've had 2 trainings with town staff, and we have another one coming up next week. We have done a lot of social media campaigns, so just getting messages out there, kind of normalizing the conversation about mental health, where to find resources, really emphasizing William James College interface referral service, and there's a Massachusetts Behavioral Health Service that's also available to people. And I've been collaborating a lot with Impact Norwood, and they're having a big focus on mental health and just wellness in general. So we've been doing things like we went to Norwood Day this past weekend and just kind of talked about the resources that are available. And we're going to have a community coalition meeting. I don't know if you want to see this.
Bob Blood was at the football game with,
Yes.
with some info.
So this is a community coalition meeting that we're having at the end of the month. Anyone can come and share any thoughts, ideas, concerns about youth wellness and substance use prevention. So that's Impact Norwood, but I just wanted to share that I've been kind of collaborating with them.
That's not just schools, that's anybody.
Anybody, yeah.
Yeah, so just to let people know, it's September 27th, 7 to 8 p.m., Simone Room at the Morrow Library, just so people, if
And
they
who will
want to
be
go
there
for
again,
it.
running that meeting?
It'll be Connor, Bob, and me.
Okay. Do they have to sign up for this, or can they just come
Yeah,
show up?
stop by.
Okay, great.
Yeah. So that's what we've been focusing on.
If anybody wants to be private, excuse me, honey, can they take you aside and talk to them and then go back in, or is this just, you know?
Do you mean at the coalition meeting?
Yes. You know,
if
I
they-
just wonder if a parent wants to say, I feel that, and doesn't want to do that in
Yeah,
public. You know,
absolutely.
can a parent, I'm all for the kids.
Yeah,
And
yep.
I want a parent to maybe, you know, extend if they feel that their kid has something that doesn't want the whole town to know.
Yeah.
So can they take you aside and maybe talk to you?
So
privately?
something, I appreciate you bringing that up, because something we really wanted to say in that meeting is that we want to make sure we're keeping everything anonymous so people
Yeah,
can
that's
share
great.
their concerns. But of course, we'll have different routes if people feel more comfortable sharing things anonymously or without, you know, to the side, that would be fine too.
It's
Yeah.
important for the student, person, and the parent to keep that. Thank you.
Yeah.
Can the community get these referral services on the website? Are they listed on the website?
The William James College Interface Referral, yes.
Yeah,
Yep.
it is, okay.
It's listed, it's posted. So we had our own health department social media, but now we're doing all town of Norwood. So it
Okay.
will be posted. We continuously post it throughout the month. We have it in different languages. Right now we have English, Spanish, Portuguese, Haitian Creole.
Wow.
So we're posting them all up there so people can be aware of this resource. That's for Norwood residents, and then the Massachusetts Behavioral Health Helpline is available to anyone in Massachusetts. Yep. Yeah.
That's good to know.
Yeah.
And most of this is free.
Yes. The services that they connect you to might go through your insurance, but the service itself, calling William James College or calling the Behavioral Health Helpline, is free.
Have you gotten any services? Have you gotten any people to use your services?
The William James College?
No, just Impact Norwood Mental Health.
So my role is mostly kind of organizing the trainings
okay.
and having people come to the trainings. But yes, people have been connecting with Impact Norwood. They're a separate grant, so they can give you more
always call
specific
the Board of
updates
Health
about that.
And they'll put them in the right direction.
Right.
The referral service? I'm
Yes.
sorry, I missed that.
If you have something that you feel you want to find out about, any information, you can always call the Board of Health, and there'll be somebody there that can direct you in the right direction to the service that you need.
I would recommend the William James College. I mean, you can definitely call us and we'll connect you with the William James College Interface Referral Service, because they have an up-to-date awareness of kind of what the wait lists look like and what services are available in our community. So,
Okay,
yeah.
good.
Where is that college?
Is it Newton?
It's a new.
He inspected it.
Thank you.
And we're just about to sign another contract with them for another year.
Great.
Good, great.
I've never heard of it being in. Is it a 4-year college?
It's like a graduate school.
Ah.
It was called something before they changed the name a couple years ago.
Thank you.
Anything else, or you're all set?
That's my
I love it. I love it.
Thank you.
You guys
Very
are on
good
this. Thank
report.
you so much.
Thank Stacy, you're up.
Yes.
Director's update.
So there's a couple of things I just want to go over. First, the state is putting out a survey. It's a health equity survey, and they're asking all Massachusetts residents to take it. So I'm going to hold up this flyer. I think the best way and the easiest way for people to do it is mass.gov/health survey, and we're gonna put this out on our webpage. We're gonna put it out on the town's webpage. It's been out on social media. And why this survey is so important is it's actually asking Massachusetts residents how they want the state to direct resources. What do you need help in? So it's a quick 15-minute survey. People might put they want free COVID kits, or people might say that they want help with housing. So you just they're asking you what what have you been finding? What is your difficulty? Or if not, you say everything's fine. And they're just gonna look at this survey and kind of figure out where they need to direct their resources. So they're really taking it to the people to find out
What their needs are.
what their needs are. And so, the library's been great. They put it out through their network. I've asked the senior center. Today, I brought it up at the department head meeting, and the police department's gonna put it out there, rec department. They post every week how many residents have taken the survey, and of course, I'm in my own little competition because I want Norwood to be more than all the other communities. So we are in the lead right now, but we need some more surveys because you really need a lot of people.
And I don't like to
Whether
share
it's-
with anybody. I don't like to team up with anybody, you know.
So, and it's important because this is where the resources are going.
Right.
So this is
Right.
our chance.
Okay.
You know, to say what we want. So
So take the survey
take
now.
the survey, quick survey. I will get that link out there. But yes, if you three could take it,
right,
that would be
take it.
great. And I'm going to send it out to all the town employees.
Right.
And then
It's easy if you have a cell phone, you just scan that.
it is. You
scan.
can can scan the little QR code.
QR code.
So
But
you
for
put
people
that like,
that
what do you?
yeah, the little
Just
QR,
take a
like,
picture.
you know when you used to go to a
Oh,
restaurant,
okay.
you take
Yes.
the menu, they had them on QR codes, you had to
Yes.
snap it and the menu would come up during COVID. It's just that. But if not,
No, no,
health
we're
survey,
good.
ask.gov health survey is pretty easy too.
Camera.
But go to the camera on my phone.
Yep.
Okay.
Show you that.
And then also a little press release on, wouldn't be a health department board of health meeting without West Nile virus, mosquitoes, talking little mosquitoes. So this DPH just put out a press release about 2 cases of West Nile virus, and then yesterday they put out a 3rd case.
For Norwood?
So, no, not
No,
Norwood,
where
just the
is it?
state. The last case was in Hampden County,
Oh,
but they put it out when it's the entire state. But Norfolk County is at moderate risk.
Okay.
So, as we all know, there's been a ton of rain.
yeah.
And so, again, when you're going out, this is the time you're going out to games, you're going out in the fields, seeing your kids playing,
Empty
soccer.
bird box. Yeah.
Wear your mosquito repellent, and then when it does ever stop raining, go out and dump over any standing water that you have out in your yard. Just keep an eye. We have to wait for the deep frost, which feels
I
like
did
it's
that with
not
all
going to
my
be
empty
coming.
ceramic pots. They were so filled.
Yeah.
Whoa.
So that's it. Just reminding everybody, mosquito-proof your home.
I have a question, Kath, if you don't
Yeah,
mind.
go ahead.
COVID kits to test yourself. They have expired. Mine have all expired. A year. And can you
Yes.
still use them?
I would not use them and we can't get them out in our office unless they officially prolonged the date. So a lot of those,
But
there
at
is,
one time, Stace, didn't we say that they could use them?
yes, but they
Because
did
they
not, I
prolonged
had
the
a whole
expiration
batch.
dates.
It's pretty much, I think on 9 months,
No, mine's
approximately
some-
a year.
yeah, a
Yeah,
year.
those are no longer, because they did not
Okay.
extend those. So I can't officially say.
So
you
where
use
can the
them.
community get them for free is what my
For
question.
free, so actually the senior center does have some, they were able to get some, so there are some here for seniors, for the senior center. When everything went commercialized, meaning the vaccine's now commercialized, the government is now out of it. So for instance, we're not mandated, we're not going around, people aren't testing, we're not putting people in quarantine, we're not putting people in isolation. That is all ended. So people can self-test at home, it's up to them to stay home, it's up to them to wear a mask if they've been exposed. And so the kits was part of the federal government, and they're not paying for them anymore. So now if you want one, you can purchase them.
You have to purchase
Oh, okay.
I have some, I have a small amount that if someone comes by, I'm happy to give them a couple of kits until they run out. But the ones I have in my office have an expiration date of August 15th, but those have officially been extended right now for 3 months. And I'm going to guess that in 3 months,
There'll be no.
they'll do another 3 months. They usually
But
do a few
August 15,
extensions.
23.
Yes.
Yes, see,
So
mine
they
were 22.
Yes,
And
those-
somebody asked me if they could have it, and I said,
No, those are, they did not extend the dates on those. So I would not give that out. So I have some at the office.
So is there going to be for people to know, is there going to be a shortage for this as the winter gets closer and your child is in school and, you don't want to send him to school, so are we going to be, a parent's going to be scurrying around for?
There's not a shortage, it's just that you have to get them on your own. They're not provided by the government anymore. We got ours, we didn't purchase ours, we got ours from the federal government, which we gave them to the state, and they gave them to local municipalities.
No, I remember
that they're not doing that.
Yeah.
And the vaccine, just so you know too, that is also, when this new vaccine comes out, we have to purchase it. It's gonna be treated just like flu.
Yeah.
We buy flu and then we bill.
Okay.
And it's gonna
Same
be
thing's
the
gonna
exact
happen.
same thing, because they are not, they're not supplying it anymore.
So Board of Health seemed to have taken a step back for this next round, God forbid if there is a next round.
So we get our direction from the CDC and the state, yes, because you're doing home testing, so there's no way for us to
No,
know.
to track it.
Before, you were going to a medical provider and that test went in through our Maven system. So
Yeah.
we would get reports and then we would put people into isolation or into quarantine. Now it's almost like the flu. When you're sick, you stay home, you stay away from other people, you self-isolate, you self-quarantine. Even with flu, you never got a call from us. So it's
Do the
treated
school
the same.
nurses have updated kids? They obviously are testing students.
No, they're not doing testing. The schools that they do their own thing, but they're not doing this either. I mean, it's the
How many
same thing.
doctor's
If they're flu-
offices are doing testing?
Yeah.
If somebody presents with all of the symptoms, fever, cough, muscle aches, soreness, they may do a test, but the patient still has the right to decline it too. They don't have to have it. So they're basically just telling you if you're not feeling well, stay home.
Right.
Yeah, but here we go again. That is left up to a parent who has to work, who doesn't really care about Mary Jane and Anthony or whoever that gets the flu, that gets COVID, and they don't have a test at home, and they say, well, you just got, it's seasonal. You got seasonal allergies. Go to school. I mean, we're back to that. I mean, because we have no control over it.
Well, I mean,
No?
when you told
It's
people to
up to a
isolate or
parent.
quarantine, it was up to them to isolate or
Isolate or
quarantine.
quarantine.
Nobody was outside their door saying,
No, I know that, but still, we're back to giving that to the parent.
well, we're trying to, basically, the word is if you're sick, stay home. So it's no
Right,
different.
but it always
Flu-
was.
You don't want the flu either.
Right.
Flu's a serious illness.
Yeah.
So it's,
And flu has been a little more, I mean, we never really had a time when we didn't see flu this year. We saw flu right through the summer, which is kind of unusual.
No, we did.
We never used to see flu in the summer.
I told Stacy years ago when my boys, kill me for saying this, played hockey at Norwood High, they both got the whooping cough from the hockey team. And I swear the Board of Health came to my house and put an X on my door. So
that was me.
Yeah, they couldn't, and I talked to the AD and I talked to the renters, and it was like, I mean, it was forbidden to even go out.
Well, whooping cough is an extremely
That's-
serious
That's
disease.
a little different.
No,
I
I
mean,
know.
these are all serious, but whooping
But
cough
I
is
feel
a- Yeah.
that for the maybe the unvaccinated student, the students don't have to be vaccinated in this Norwood school system, do they?
No, nobody
No,
has to,
so here- so-
nobody has to be
so this is what I'm just
vaccinated.
saying.
Yeah.
They may not be covered again.
But that's gonna
Protecting the
be, that.
kids.
But that's their choice.
I know, Kathy, but
And,
That's
you
an
know, and-
individual choice,
Right,
correct?
and they'll tell you that. It's my choice as to whether I want to be vaccinated or not.
right.
And so you can't, the reason we did the quarantining and all of that stuff was because we were in a pandemic level.
Okay, that to me I have to still.
That's why we did all of that, because if we didn't, we could have been in, I mean, we would still be in a pandemic crisis if we hadn't done what
Well,
we did.
you remember the phone calls, the parents
Right.
wouldn't call us and tell us their child had COVID, and they wouldn't give us their name. Nobody wanted their kid to stay home.
Right. So it is, we can't take away their choice to vaccinate or not vaccinate, it's whatever, so, but the message out there is, if you're not,
sick, stay
if you're
home.
sick, stay home, And I know that there are parents working out there, we all had sick children,
All of us did.
at one point in time, and, we had to make a decision. Did we stay at home with our kids that were sick? And oftentimes, we took a sick day from work ourselves.
Very much so,
because,
yeah.
so,
God, Stacy, thank you. It's just so much.
Anything else, Stace?
That's it.
Thank you, Stacy.
Joan, do you
No,
have anything?
I'm all set.
I just want to welcome everybody back from the summer, even though
Yes.
it was not the best of summers.
No.
So, stay healthy, everybody out there, and we are at
Welcome,
the
Kyle.
end of our, yes, welcome, Kyle.
Hey, Coach.
Some of you want to make a minute?
I'd like to make a motion that we adjourn.
Do you want to second the motion?
I do want a second motion.
Meeting is adjourned. All in
Meeting's
favor?
adjourned.
Aye. Thank
Aye.
you.